I'm Mary and I'm consultant clinical psychologist, and I'm here today to talk with you about fear of recurrence. People often report feeling worried about whether the treatment's been successful. They worry whether their cancer will return. This is a very normal and understandable response. Everybody's slightly different as to how they worry, and worry can be both helpful, but it can also be quite undermining. A very common thought is interpreting or misinterpreting physical sensations such as tiredness or forgetfulness as evidence that the cancer is recurring. And it's really helpful for people to think about what other alternatives could there be. At the end of treatment, people usually feel tired, end of radiotherapy, and that can go on for a long while. So being able to say to yourself, maybe there's other explanations which can explain your tiredness. You will have been told by your team, your clinical nurse, about particular symptoms to look out for. And if you do experience any of those and you're concerned about them, do feel able to call your team and to seek advice. You will find in time that you will get very expert in knowing what to attend to and what not to. Very often people don't want to talk about their worries with their family or their loved ones for fear of upsetting them. People commonly say they feel quite isolated because they don't feel they can talk about it. So the first thing I would suggest is that you take some time to notice and become aware of how you worry. You might become very anxious, feel sick, feel tired, which again can be interpreted as evidence of further disease. And behaviour-wise, people might find it difficult to sleep, they might have changes in appetite, they might avoid seeing people or talking about things. Once you've identified and recognised how it shows itself in you, then begin to think about what you can do to feel more relaxed. Just giving yourself some time, scheduling in some enjoyable activities. Do something for yourself, however small, each day, something you enjoy. Reading the paper, listening to music, maybe physically doing some relaxation or some gentle exercise. And for a lot of people, just knowing that what you're experiencing is normal and there's nothing to be worried about is enough, is sufficient to sort of set them on their way. For other people, the way in which they're responding to their worries or their fears of recurrence really can lead them to being stuck. And when they're feeling a bit stuck, that can be a good time to go and see somebody who does see this a lot and who can help you understand a bit more about what's going on to get things moving and to get you feeling better. There are lots of places where you can come to begin to have that conversation. There are information centres, there's Macmillan Cancer Centre. Find out what's available in your area and what's convenient.